honorable ministers, ladies and gentlemen of the press. Let me start by wishing every child out there a happy Children's Day. Leaving home this morning, my children challenged me that they'll be watching us this afternoon very attentively, so I have to be at my best. They asked me what I wish for, and I said I wished I was a child again and I didn't have to be at the presidential press briefing every afternoon. But having said that, it's obviously a privilege to be here, and this is kind of the example that we want our children to live up to. We tell them every day that they are the future of our country, but we also know that they are going through very difficult times. We had a very animated discussion in the PTF meeting yesterday, and I'm sure the Honorable Minister of State for Education will brief the country in detail on how passionately we're thinking about all of them and what the next steps will be. But rest assured that everybody in the country, everybody in this task force is really thinking about the impact of this pandemic on the children, their future. As we try and solve the short-term challenges, we also have to think about the long-term challenges. And it's definitely not an easy period for any of them. Even those that are privileged to have some sort of access to education during this period, many of them are still at home and learning how to cope with the sometimes isolating environment of staying at home every day. We all have to find methods, and this is one area where nobody can say he knows the right way or the wrong way or the best way. But what I've found is, as much as possible, to use this as a teaching moment for them in terms of science, in terms of the work that we do, to be open and transparent about the challenges that we face, both in terms of teaching, health, and obviously the most difficult of all of them, being a good parent. So really wish all the children out there happy Children's Day, and rest assured that we're working very hard to ensure your future as well as ensure the health of our country. Having said that, the other thing I'd like to speak a little bit about today is some emerging new studies. Like I've said severally, we are really learning in real time about this outbreak. So every time we stand up here and speak, we have to speak with humility, knowing that something we said a few weeks ago might change as new science evolved. When we started this, not everybody was wearing a mask. But as the evidence around the benefit of wearing a mask comes together, then we make a decision and we act on that collectively. And really, this is unique in the history of infectious diseases, that you have an outbreak that's really being learnt on and new knowledge is being applied in real time. So the most important bit of new knowledge is around the test that we use. So we use a test called real-time PCR, polymerase chain reactions, to detect the virus. Now, what this test actually does is detect fragments of this virus. Now, what has emerged over the last few days is detection of fragments of this virus over time doesn't in itself mean that there's an active virus over time. So studies have now shown, using this PCR test, in addition to something we call viral culture day to day, that the longest viability period of the virus is about 10 days. So this virus, even though we can still find it on PCR after 10 days, 20 days, and you can see in some of the cases here, some of the celebrated cases we spoke about and engaged our minds, because we couldn't discharge those patients at that time because we did not know how long the virus remained viable for. But now with this new finding, we know that the virus is viable for around 10 days max. So we're now relooking at our practice, both in terms of discharge criteria and even who to keep in hospital and who can stay at home and for how long. So right now, the entire case management team, which includes colleagues at the Federal Ministry of Health, the Nigeria Center for Disease Control, and a few clinicians, are reviewing our case management guidelines, following new guidelines that have already been released by the World Health Organization based on these new findings to redefine our approach around admission, both in terms of who is admitted and duration of admission and when to discharge. So we're going to release these new guidelines as soon as we achieve consensus on some of these major issues, and then continue to learn. If we're able to do this successfully, it will have big implications on the duration of time people spend in hospitals and when they can be discharged. That will enable us bring in people more frequently. It will ease up some of the bed space and help us in some of the more practical challenges we have day to day. So that's just an example I wanted to leave with you today on how in real time new science is emerging. We're translating this into new guidance and using those new guidance in real time to change our response. Thank you very much.